The 90-90 is a pretty popular exercise looking at glute mobility, flexibility. I just want to give you a couple of things to think about when you're cueing this with your clients and patients. Now, obviously, the most obvious thing is that 90-90 refers to 90 degrees in the front knee and back knee. It's something that a lot of people often miss. We see people setting it up here like this, but the important thing is that the knee is in front of the hip here. So we're not setting up over here and we're not setting up over here. A lot of times people are going to set up over here because they feel more stable on their pelvis, especially if it's on the side that they rotate away from in their pelvis. So we're looking to be knee straight in front of the hip. Now most people are going to want to post on the same side hand because they might feel like they're kind of falling over. That often will bring someone, as they come down, to want to bring their chest over past their knee here. And as we do that, we're going to be shortening the glute rather than getting it to create tensile load through its range. So we want to come over here. Now, the other thing to look for is that if we're looking to work through the glute here, we do want to make sure that we're getting posterior tilting of the pelvis. But often we're just getting lumbar spine movement like this. So oddly, I'll usually cue chest up, which you would imagine would bring some anterior tilting in the pelvis when we bring the chest up. But once we get here, then we can start hinging at the hip and getting some load into the hip there. Obviously, that's bring the glute on stretch here. But the point I really want to make there is that we're not hinging from the lumbar spine. We're looking to load up and forward, and then we can come down. There's no movement here. People will often want to come as far as they can into it like this. But obviously that's taking load out of the glute here. In terms of this posting on the left hand, we want to use that hand to keep ourselves centered in front of the knee, and I'm going to rotate the opposite side shoulder towards the calf. Now obviously that's going to give a bit of torque into the glute here. So we're going to rotate down and we're going to look to come forward a little bit, and we're getting some hinge at the waist. So obviously you're going to get hamstring and that sort of thing too, but this is going to help us to target the glute a little more. In terms of this kind of loading to the left, we certainly can bring the stretch over here and even bring it all the way over here too if we wanted to. And that's really going to wind up some of these fascial connections, which is great if that's what you're looking for. Be very careful with doing stuff like that with people who are experiencing low back pain, and also with this position in general actually. There is quite a lot of torsion involved in this movement. So the main things I look for, chest stays parallel to the shin, and we get that through cueing opposite side shoulder towards the ankle. We're looking to post off the same side hand in the early stages anyway and come down. In the later stages, we want to see if we can keep that movement without our hands, staying flat here as we progress through our phase 2 and phase 3 exercises here. We're looking to also keep this knee here, but some people do start to experience cramping in their TFL. So in that case, you can bring this rear knee forward, and that might make it a little bit easier for people to do it without cramping. Obviously, some people like to look at the internal rotation component on the back leg here, and that's something else entirely we can look at. But if you're just doing it for this targeted left glute, they're the main cues that I would look for.